How is the FRAX tool used in osteoporosis screening? Have you ever wondered how healthcare providers assess the risk of fractures in individuals with osteoporosis? The FRAX tool plays a crucial role in this process. It helps estimate a person's 10-year probability of experiencing a hip fracture or a major osteoporotic fracture, which includes fractures of the spine, forearm, hip, or shoulder. This tool combines clinical risk factors with or without bone mineral density measurements to evaluate fracture risk. The FRAX tool is primarily used for postmenopausal women and men aged 50 years and older. It is particularly beneficial for individuals with low bone density, known as osteopenia, especially if they have not yet started medication for osteoporosis. The tool calculates fracture risk based on various factors. These include age, sex, weight, height, previous fractures, family history of hip fractures, smoking status, glucocorticoid use, rheumatoid arthritis, secondary osteoporosis, alcohol consumption, and, optionally, femoral neck bone mineral density from a dual-energy X-ray absorptiometry scan. In practice, a healthcare provider inputs the patient's data into the FRAX calculator. The calculator then provides the 10-year risk percentages for both hip fractures and major osteoporotic fractures. These risk estimates are essential for guiding clinical decisions. If the 10-year hip fracture risk is 3% or greater, or if the risk of a major osteoporotic fracture is 20% or greater, treatment to reduce fracture risk may be recommended. On the other hand, lower risk scores might suggest that monitoring or lifestyle changes are more appropriate than immediate medication. The FRAX tool is valuable, especially when dual-energy X-ray absorptiometry scans are not readily available. It complements bone density results by incorporating clinical risk factors, helping to prioritize patients for further testing or treatment. This approach aims to prevent fractures by identifying individuals at higher risk, even if their bone mineral density does not indicate osteoporosis. Recent studies have explored specific FRAX cutoff values to enhance screening accuracy in different populations, such as older adults in Thailand. These studies have shown good sensitivity and negative predictive value for detecting osteoporosis, further supporting the FRAX tool's role in initial screening before more definitive testing. In summary, the FRAX tool is an essential resource in osteoporosis screening. It estimates fracture risk over 10 years by combining clinical risk factors and optional bone mineral density measurements. This information guides healthcare providers in making informed decisions about further testing and treatment to help prevent fractures in at-risk adults. Always consult with a healthcare professional for personalized advice regarding osteoporosis and fracture risk.